Pat came to reflect. It was done by Prerna Kandasing in the year 1948. Now I asked the same thing, who was the first cardiologist in this hospital? We didn't know that he was Professor A. Srinivasan, late A. Srinivasan. So that is the ignorance of our own people who have done a lot of things, pioneering work, but they are forgotten. But other people are remembered because they are written in journals, they are quoted in textbooks and all. So I want to encapsulate in a short time our experiences we had from the time I joined the cardiothoracic department, as well as what my beloved chief, late Professor Sadasivan, faced in his life to start the department. See, in the late 50s, that is between 55 and 60, 57 to be exact, there were two young, starving-eyed people. One was a physician in Railway Hospital, another was a surgeon, general surgeon in Government General Hospital. So, expert care was given only by the government institutions, and these people had a lot to learn. And I myself joined the department along with my colleague, Ms. Momo, Dr. Shakir, in the year 1966. Dr. Sadasivan was a very lovable person. He was a difficult man. If you don't work, he will shout at you. He was a taskmaster, but at the same time, a taskmaster whom everybody loved. For example, the late neurosurgeon was a B. Ramamurthy. He used to call Dr. Sadasivan angel when they meet on rounds. So that was how he used to behave with all of us. He used to treat us very well. Whenever we see him, we used to feel so happy. He would create happiness in others. And such a man, I joined the surgery department in 1966 for MCH. And the first open heart surgery in GS was done in the year 1969. At that time, centers in Delhi and Bombay and Bangalore had already done a few open heart surgeries. So Dr. Sadasivan was feeling it in a bad way, Vasu, we must start, he used to say. At that time, I am speaking about Professor Solomon Victor, who is also not here, who is no more. He was in the United States. So in 1967, March 18, to be precise, I remember the date, we did the first open heart surgery. It was operated by my professor, Dr. Sadasivan, assisted by late Dr. Shakir and Dr. Parameswar, who is also now in state, and the pump was done by me. I ran the pump along with the person who helped me, Dr. Parasura, and I had no training in running the heart-lung machine at all. I had absolutely no training. I read all books that were written on rheology, used to be called, and pump, and I knew all the theory knowledge behind it. So I used to go to the veterinary hospital, and there used to be a veterinary department in GS near the anatomy block. So we requested the veterinary people to give us dogs. So we will connect one dog to the heart-lung machine, and to run the machine we need blood of 4 dogs. So we used to kill 4 or 5 dogs, bleed them to death, use that blood to run this machine, and keep this dog going alive for 3 or 4 hours in the machine. And even after we start the machine, after doing some procedure, we'll cut the mitral valve and screw it up again. The dog used to come alive. But unfortunately, there was no postoperative care. We used to miss that. I'm so glad Mr. Tambaya has come. You are my teacher, sir. I'm so grateful that I am here in your presence. The whole meeting is blessed because of your presence.
Nothing surprising to see a teacher identified.
Thank you, sir. Great. So I'm deeply honored because of this, in addition to this. So we ran the heart-lung machine on March 18. First case was operated by Professor Sadasivan. It is a 10-year-old girl. And today she is still alive. She's got 4 children. Then Professor Sadasivan in his death did 4 operations, open heart, all 4 open heart surgeries. And all of them, 3 of them are alive. 1 of them we lost on the table due to an accident that happened at that time. That's not important to say what it is. But those days, we had no disposable pump packs. So we used to buy in meters, 100 meters of arterial line, 100 meters of venous line, 100 meters of pressure lines. And for each case, we used to divide, pack them, sterilize them, and assemble on the morning of the surgery. And the oxygenator we used was not a disposable oxygenator which we use now. It was a repeated use oxygenator, what is called disc oxygenator, which is not used anymore. It is historical. But first 4 cases in GH were done by using the disc oxygenator. Then unfortunately Professor Sadasivam passed away early in life. After doing 4 cases, he was not alive to do the 5th case. Then in the year 1972, I returned from England after having been trained by Professor Hamilton of Liverpool and Professor Stark of Great Ormond Street. And I learned all about pediatric cardiac surgery. I was here. At that time, Professor Lakshmi Kantan was the cardiac department cardiologist. And he has trained all the people here, most of the cardiologists. Most of the names that you find here, Dr. Tirumalai, Dr. Varmendra, they were all students of Professor Lakshmi Kantan. And then of course, when I came back, Professor Victor, who is no more unfortunately, he had returned from America. And we both were blessed to start the open heart surgery maintained. And in my sojourn in GH as a cardiac surgeon, especially for pediatrics, I had the pleasure of having many capable doctors who helped me. In fact, my first assistant was Dr. K.N. Dharmirajan, who was seated there. And then subsequently, I had the pleasure of having Dr. Srimati, Dr. Vijaya Shankar as my assistant. Like that, we continued, we did everything in GH. And I am always, sometimes in professional circles, I am always found fault for having done one particular operation in blue babies. And that is called POTS operation. For those who are not doctors, I would like to explain that POTS operation is connecting the main blood vessel, aorta, to the blood vessel supplying the lungs, pulmonary artery. It's an aortopulmonary shunt. So in the Western books, what is written is this operation is given up. Nowadays it is not done because it will give rise to pulmonary hypertension. It means high blood pressure in the lung. So actually nobody did that. None of the other surgeons in India also did the POTS shunt. I have done the maximum, Dr. Srimati knows. I have done more than 150 POTS shunts in my sojourn in GH as pediatric cardiologist. Now, why would I do a heart surgery which is not recommended in the books? Am I an idiot? Maybe I am. But the reason is, any time in the hospital, you will see 10 to 15 patients of tetralogy of the ward. All these guys, Chokalingam here, Tirumalai here, Aragesan here, all of them know how many patients will be waiting for surgery in government general hospital. Now in those days, if you want to do complete correction of a blue baby, it is called intracardiac repair. You open the chest here, connect the baby to the heart machine and correct all 4 defects. It's a beautiful operation to do, and I think Professor Balakrishnan will talk about it. But anyway, we had facilities to do that. We have done a lot of nodal corrections. But in those days, to do an intracardiac repair, the things we needed was first, anesthesia would not accept unless we have 6 to 8 pints of blood reserve. And then of course we need a ventilator in the post-operative ward, and we need a slot in the post-operative ward at least for 3 or 4 days. And we need doctors to stay by the bedside. Now most of the patients who come to government general hospital in those days are poor. Poorest of the poor, if we can use Mother Teresa's sentence. They are very poor. They can't afford even to stay in a hotel when the child is in the hospital. So if they come, they will not go again. They stay till the operation is done. That's why when my bed strength is 10, anytime there will be 40 patients in the ward. People will be lying down on the floor. People from depressed others come and say, oh, GH is dirty. So many people are lying on the floor. But they never realize why this is happening. They cannot afford big private setups where they can pay the fees. So, to wait for intracardiac repair for one case sometimes take 1 month. So all these things to come together, blood, then post-operative slot, then ventilator availability. All these were not available. Old facility we had only 2 ventilators those days, and we used to operate 8 to 10 cases a day. So most of the cases went without ventilation. We used to cut a lot of corners, but at the end we used to have 95% of the patients alive, which is not mentioned anywhere. So everywhere people say these GS people are no good, they don't do good operation, good cardiac care, nothing is there in GS. That is the impression. But I think that's totally a wrong impression. GH also people do a lot of good work. Of course, in private sector, people are doing tremendous work. I don't deny that at all. But they don't starve for these facilities. They have it in them. So the reason why I started speaking about this, why I did this shunt which is said it is given up, should not be done. I found that doing this shunt, the child was absolutely blue, immediately becomes pink on the table. And in fact, one of the parents, the children were semi-educated. He saw the child when he came down from the operation theatre. And then he told me, sir, child is top pink. That's the first time I heard that expression. And I thought it was bloody good of him to use that particular expression. Anyway, and subsequently, now some of the children whom I have operated have lived for more than 40 years. Some of them have got married, some of them have got babies. And the shunt is still functioning. Many of them did not develop pulmonary hypertension. And here Dr. Balakrishnan is here. He has redone the original parts which I have done. He has undone that and done intracardiac repair. That is total correction on more than 20 of these patients. So the surgery or treatment which you apply, especially I mean for the youngsters who may be present here, MCA students, is that you must tailor your surgery according to the needs and according to the availability of material. You should not say in America or England they have done that, I will do only that, and I will not do anything till I get anything done. That is the principle which we have followed in GH in the good old days. Then in 1987, I opened the pediatric cardiac surgery unit in Children's Hospital. At that time, I had the honor of having Dr. Melvin Joseph as my cardiologist. And the first open heart surgery in Children's Hospital was done in March 1988. It was a left ventricle, right atrial fistula. In other words, the non-doctors, it was an abnormal communication between the left ventricle and right atrium. And that patient is still alive. It's a very simple procedure nowadays. Nowadays, of course, the whole thing, open heart surgery, everything is advanced so much. In our days, Saul and Victor, myself and other colleagues of mine used to struggle so much to do a single case. Whereas nowadays, a postgraduate student who joins MCS can replace a heart valve in 6 months in government general hospital, of course under supervision. So things have advanced so much that I am very happy that it is happening. And then, of course, there is full support from the cardiologists, medical side, and general physicians who refer patients is absolutely necessary. And then of course the same cardiac surgery can be done in a much more numbers and in an elegant way has been demonstrated by two great surgeons who are not here, especially Dr. M.R. Girinath, who is my good friend, and Dr. K.M. Cherry. In different hospitals they have done open heart surgery. And now there are others like Dr. Rajan, Dr. Balakrishnan, who are doing excellent work. And Dr. Vijay Shankar, who is there, he is specialized in aneurysm surgery, which is one of the most difficult to do. And so I think the whole thing is going, and it is good for the country, and it is good for the nation. And I am so happy once again that I was called to speak here and preside in this function. I am grateful to Mr. Raghavan, and I hope Mrs. Raghavan, Sudha's soul, is watching this, and I think she is blessing us. Thank you.